Hey everyone, this is Rosalina.
And this is Shauna, and we're your hosts for Too Young for This Shit podcast.
This podcast is not just about boobs, but our journey with cancer. We are young millennials, open about giving you our raw and unfiltered look into our lives. We are in no way medical professionals, nor are we offering medical advice. Any medical references are cited directly from public websites or from our personal diagnosis. Some topics and stories may be triggering to those who are fighting, have fought, or have loved someone with cancer. Hey everyone, welcome back. In this episode, I'll be talking about my surgery and my recovery. Shauna told her story last episode, so now it's my time to share what I went through, and hopefully this helps you guys with anything that you're going through. If you're going through surgery or anything like that, hopefully our stories help you learn and gain anything out of this. Before we begin, I was reading this book called The Book of Moods, and it's by Lauren Martin. I was reading through a chapter and I felt that this specific portion really resonated with me and something that, I want to start doing in my life moving forward, especially since my diagnosis. And so I really wanted to share this portion over to you guys, as maybe this could help you as well. She begins with, "It's impossible to be happy all the time. However, no one should ever aim for that goal. Instead, we should aim to love ourselves all the time. Because unlike happiness, self-love isn't fleeting, yet like happiness, it attracts good energy. Corny as it sounds, self-love is really just less self-judgment, less overanalyzing, less negative self-talk." I really resonated with that because since this diagnosis, it's been a big part of the change that happened, in my life and of course in Shauna's life too. And I really want to start focusing on just loving myself, loving my new body, loving this new life that I have to encounter, and knowing that the goal of being happy all the time shouldn't exist in our world.
Definitely not. It's impossible.
Yeah, it's impossible.
And,
Absolutely.
I like what you said about, like, learning to love your new body. And I think that that's kind of hard right now, my body, but like, I feel like I don't know this new body. Like, it's not recognizable to me. And then there's, like times where I'm like, my body has just been through like a train wreck, basically, like the amount of trauma and between surgeries and chemo and, soon to be radiation. Like, I mean, my body has endured so much, and it's almost like it, I feel like a sense of strength like I've never had before. Like, I think we talked about that as far as like overcoming chemo. Like, I just think it's definitely easier said than done, but I definitely want to start doing that as well, like rather than talking about how much weight I've
Hmm.
gained and how my body doesn't have, the hormones and this and that. Like, it's just, I do need to appreciate it a little bit more. So it's definitely a good reminder.
Yeah, it's definitely a good reminder. And I've dealt with shaming myself because of how I look. I was never happy with how my body looked. So now with the surgery and the radiation and everything like that, like I know that my breast would probably look a bit different after all of this is done. And so I just want to remind myself, just like take it one step at a time. And instead of having all these like negative thoughts about how your body should look like, just start accepting how it looks as of right now. And so just wanted to share over that with you guys. Even though maybe you're also struggling with loving yourself, we are also struggling with that as well.
I mean, I definitely have an acceptance of, like, this is my new body
Yeah.
right now, but learning to love it is a whole other aspect of this. And I think, it's super important to touch on it because, even if you've come to the realization like, okay, this has happened to me, or, I have to have this surgery, or I have to do this, or anything that, you go through within your breast cancer journey, it's very different. The acceptance and love, I think, are
Mhm.
different in this situation for sure.
Now, going through my story, I first want to share over exactly what procedure I got done and where. I got my procedure done at UCLA here in California. And the procedure was done by my breast surgeon, Dr. Baker. She performed a left skin sparing. In a skin sparing surgery, it's an option for many women who desire immediate reconstruction after mastectomy. It's essentially where you can preserve your skin in order for it to be reconstructed within the same surgery. A non nipple sparing mastectomy, so removing the nipple from my left breast, an excision of the dermal lesion. So I had a little cancerous bump on top of my left breast, so they had to remove that layer from my skin. And then finally, a left axillary lymph node dissection. So that's what she performed for me. And then I did a breast reconstruction, just adding the tissue expander um, in my left breast after the tissue was removed by Dr. Baker. And so that addition to the tissue expander was performed by my plastic surgeon, Dr. Slack. Kind of going into my story, I just want to begin this with that just looking through all the posts from the breast cancer groups, I guess I didn't feel like I was as prepared as maybe other women before my surgery. And so I think just the reasons for that, I was really focused on two things. So, one, I really needed to set up my paid family leave so I can take some time from work to recover mentally from all the mental exhaustion I went through with my diagnosis, but also the recovery, my surgery. I just didn't know how long I would need in order to recover. So I just wanted to make sure that I had enough time before I went back to work. And then the second thing that I really was focused on is just getting rid of this tumor that was inside my breast.
So that's valid too, Just, I mean, those are like major things that needed to obviously get done before, you know, you had surgery and had to recover. Like, yeah, I think we all just kind of cope, like my thing was to be in control. So I ordered everything and I felt super
Mhm.
prepared, and like that was my way to have any type of control over the situation. You focused on, checking things off your list before you had to endure all of
Yes, exactly. I wasn't really focused on how I was feeling. I was more focused on I need to get these shit done before my surgery date. But I did purchase some things. I purchased like a few mastectomy bras, oversized sweaters. As after the surgery, I won't be able to move my left arm as much, especially since the guidelines that the plastic surgeon has sent over to me, I won't be able to move my left arm past 90 degrees until I believe it was like the 6 week mark that she gave me the okay to move my arm past 90 degrees. Another thing that I purchased was a large mastectomy pillow just when I'm sleeping for a couple weeks. Essentially, you're going to be sleeping on your back. So I just had a mastectomy pillow that was on top of me. So it's just for me to like kind of block myself from sleeping on my side. That's just how I did it. I don't know how you were able to sleep on your back.
honestly, it was like the worst. I think it took me like a solid almost 3.5, 4 weeks, and it was a rough 3.5, 4 weeks. But the
Yeah.
pregnancy pillow for me was great. I used the mastectomy pillow like in the car. which I felt was really helpful. Like the seatbelt
Mm,
blocks it
mhm.
and it's just like a little extra
Yes,
padding.
I actually did purchase a little padding over, the seatbelt too, just for some cushion. I just wanted to protect that area as well because it's pretty, like, sensitive, and obviously you just came from major surgery, so you don't want anything to
Yeah.
happen. Then lastly, I bought a small little apron that had, like, 2 pockets where I could just store my drains.
Yeah, I saw those on Amazon. Did you end up using it?
I
You
did end
did.
up using it, yeah. I didn't like that it was drains were just hanging out. I just felt like, they could rip. I don't know. It was
Yeah,
just
yeah,
my
yeah. No.
anxiety that, like,
Oh, no,
it could rip
definitely.
out. I felt comfortable just having something around my waist where I could just store it in the pocket, so then it actually sits by my waist.
Okay, so okay, because mine came with the clips that just clipped on top of my mastectomy bra.
I did have that too.
Mhm.
I didn't feel comfortable, like, clipping on my bra because when
Yeah.
I actually wear a sweater and I was going out, I just felt like I looked weird
Mhm.
with it, so that's why I just felt more comfortable just having, like, a little apron thing wrapped around my waist.
Mine came with, like, somebody had, gifted me, like, a mastectomy robe, which was so nice, and it was so soft, but I, like, didn't even use it because the clips were just so easy, and then I just wore zip-ups the entire time, like,
Mhm,
oversized
mhm.
zip-ups, because like, I couldn't imagine, like, having to do, like, all the buttons on, like, a button-up, like, shirt or, some women just you do, like, big
Yeah.
oversized button-up shirts, and I was like, "I don't feel like dealing with the buttons on this," and just the zipper just seemed, like, easier.
Yeah, right. That just reminded me. I think also the reason why I purchased that apron is because it was just really easier for me to just take it out and dump it into the
Mhm.
cup instead of just like unclipping and clipping. I don't know. I just wanted to make it easier for myself.
Did you, strip your own drains, or did your boyfriend
No, I did.
help?
I wanted to.
You did it.
Yeah.
Really?
That was it was a control thing. I really wanted to do my own.
I didn't wanna do mine at all, that's so funny you said that. I'm like somebody who, like, needed to be in control of every aspect of my
Yeah.
situation, and that was the one thing I was like, "You do it."
That's so funny. I wanted to touch upon the paid family leave. So, some states like Washington, California, New Jersey, just to name a few, at a state level, they give people the benefit to be partially or fully compensated for their time away from work, for any family caregiving needs, or just if you're going through an illness, just like breast cancer or any form of cancer. Some states do require proof that you worked for like X amount of hours in that state in order to be eligible for that paid family leave. And you need to also provide a letter from your doctor just explaining why you need time away from work and how long, etc. So I was under Washington's medical leave program. And of course, because of the pandemic, the application process was just really long, where the approval or denial process kind of took about like 4 to 5
Oh,
weeks.
wow.
And that's why my primary focus was, okay, I need to get all the paperwork that they need in order for me to be approved and in order for me to be compensated during the time that, I'm not working.
Right. Did that delay your surgery date?
No, I had a
No.
surgery date and I didn't want to move that. It was just I needed to get the
Mhm.
application done, like, weeks in advance. So, once I knew my surgery date, which I knew, like, in advance,
Right.
I think 3 to 4 weeks, I would say, I started the application right away. Thankfully, I did get approved, and so I received 8 weeks of paid time off. Washington gives you up to 12 weeks, but the other, weeks that I didn't use, I used up, during the time that I needed off when I had chemo infusions. So you can split up your time if you want, or you can use up the whole 12 weeks, but I decided to just use only 8 weeks and then the other half for anything else that I needed time off.
Now is the paid family leave, is that per year? Like, 'cause what will you do for your, like, exchange
The
surgery?
time that your application was approved, my application was approved in April. Those 12 weeks that I've been granted, it goes up to next April. Now going to my surgery dates and when that was. It was on April 8th, and I believe the time was around 7 a.m. I remember it being really early. It was on a Thursday, and my brother George and my sister-in-law Abby flew in Wednesday night to be there for me doing my surgery and my recovery. I was really getting everything ready. As I mentioned, I was really checking the boxes of what I needed to get done before surgery, that I didn't really take time for myself mentally to prepare for this major surgery that would just change my entire life.
Did you have, like, a freak out
I'm
beforehand?
getting there. Yeah. Because I remember it
Oh,
took
you're gonna get into
you.
it?
No,
Okay.
it's okay. It took you, I think, the night before.
Yeah, like 10 PM the night before.
Yeah.
Mhm. Yeah.
So, it hit me Thursday morning,
Okay.
4 or 5 AM. Since the hospital only allowed 1 visitor to be with me until it was time for surgery, my boyfriend Brian, George, and Abby, we all agreed that Brian would be the one to drive me and to be there with me at the hospital. But that morning, George and Abby still decided to wake up early, and Abby notified me that my brother George wanted to come even if he had to wait in the car. So I thought that was really nice of him to do that.
Yeah, that is sweet.
When my brother George came down the stairs, my emotions were just uncontrollable, and I started to hysterically cry. And I walked over to George and held onto him so tightly that I didn't want to let go of him. I realized, holy shit, I'm getting this major surgery and it's happening. Like, I can't go back. I'm losing my left breast. My life is going to change. So, the one thing that I do remember when I was, hysterically crying and holding to my brother was that he told me this procedure, this surgery is for my health
Right.
and it's for me to get better. Well, I would never forget that moment and those words because I really needed to hear that. I needed to hear it because I wanted confirmation that I was doing something important for me, for my health.
I also think too, I think, like, that's your brother. It's known you your whole life. Like, it was like a moment where you could be super vulnerable without, like,
Yeah.
having to be so
Yeah. Yeah,
strong in
you're
that
right.
moment.
Mhm.
With my boyfriend, like, he was such a rock for me, and, like, it made me wanna also, I think, feel, like, a little strong and, like, "I got this. I could do this." Not saying that I wasn't vulnerable in front of him, but I think, like, if I saw my brother that morning, I would have been probably a disaster, or my sister. I think it would have actually made me more upset.
My boyfriend, Brian, he, like, just didn't really know what to say or, like, really, like, he didn't know what to say at that time, at that moment, but, like, you're right, it hits different when you're with your sibling and they're there for you and you can be vulnerable with them because, you've grown up with them your whole life. So, kind of fast forward to that, driving to the hospital. I walk in, I got checked in, proceeded to enter the room, get dressed into the gown, waited in bed.
Were you still crying at this point or no?
No, once I heard those words from George, I basically stopped crying. I stopped crying because
Mhm.
I knew that I had to do it, and my mindset switched to, "Oh my god, I'm losing my breasts," to, "No, this is what I need to do."
Right.
Anyways, I get into my gown, and then that's where the chaos starts. Many people go into your room, nurses, doctors, assistants, you name it. So,
At least they wheeled you in.
oh yeah, that's true. Yeah. But this is before you go into the surgery room. People were taking my blood.
Right. Like
Yeah, the
pre-op.
pre-op, yeah.
Yeah.
People were asking me questions, like, what procedure was getting done because they wanted to make sure that I knew exactly, why I was there. Um, and then they also ask you if you're pregnant and it's really important for them to know whether you are or not, and then you can sign a waiver if you don't wanna, like, pee in the cup. So, obviously, I signed the waiver. I was like, "Hell no, I'm not fucking pregnant. I have the IUD." Like, no.
Right.
Also, during that time, I saw my breast and plastic surgeon one last time before I headed over to the surgery room, so I thought that was also really nice too. But I think the best parts out of this whole experience was the nurse anesthesiologist because he was super calm and asked me if I wanted any, like, essential oils to calm my
I didn't
nerves.
get that.
I know, right? It's just I didn't know that was a thing.
I didn't know that was a thing either. Well, also because like, you can't wear deodorant before, like, I'm surprised they even, like, allowed that.
I think maybe it's just maybe it's just UCLA. Like, he had grabbed some sort of tissue or something and applied it around my bed, maybe. It wasn't applied on my skin. He also warned me that when I go into the surgery room that there's just going to be, like, a flood of people on me and just trying to get things moving, so I really appreciated that. Like, you have anxiety and you're nervous and all this stuff, and just people, like, touching you and everything could be, like, uncomfortable, so
Like, there's so much going on in that room.
yes,
There really is.
it really
And
is.
is UCLA a teaching hospital as well? Like, did you have
Yep,
students, or did you deny the students, or did you
there were students in there.
there
Before
were
going
students?
into the surgery room, he did also ask me if I wanted a sound bath. So which is if you guys don't know what a sound bath is, it's just a meditative experience that could be used with healing instruments using, the gongs,
Gongs or the
bowls.
bowls.
Yep,
Yep.
yep. So, I was grateful for that he was able to, provide the essential oils and do the sound baths. Basically, when we got into the surgery room and I had to get up onto that cold table, that's when he started to do the sound bath. So, I thought that was really nice.
This is so
I think
California. Like, New
so.
York, this is like New York, they literally are like, "Let's go." You walk in, you put yourself on your own table, and in LA, you get, like, sound baths and essential oils, like, that is such an
Whole
LA
different coast,
thing.
man. Whole different coast.
My
Yeah,
god.
I know. But, like, I feel like that was the best experience for me. Seriously.
Definitely. I mean, that would've been really nice. I don't
Yeah.
New York just wants to make you hard.
But I think with your story, how you mentioned you went into the room and tried to make a joke. I thought that
Oh, well, I was a complete idiot, yeah. I mean, like, everyone was laughing, like, it was, like, a definitely, like, nice way to kick
yeah.
it off, but, like, no, normal people don't walk into their room, like, making jokes, like, before their double mastectomy, so
But you tried to
yeah.
make something out of it. I think that was good.
Yeah.
I was in the recovery room when I woke up and felt pretty nauseous from the anesthesia. They provided ice to chew just to calm my nausea, some nourishment like apple juice and crackers. They don't really give you like a meal, which I thought they would, but I guess not. So, anyways, right?
Yeah, I didn't get a meal until I got back into my room, but even then, like, you're just so out
Yeah,
of
you're
it
so out of
that
it. That's true. That maybe like
yeah.
that probably was the best thing.
Yeah. I think, like, I woke up and I only ate, like, a fruit cup or something, like, once I got into that room. Like, I didn't even I was so just out of it. Did it take you a long time to wake up?
I think I finished around 1 PM, but I didn't wake up until like 3 PM, so like 2 hours.
Did your plastic surgeon and surgeon work, like, tandem? You know, once your breast surgeon was done with one side, they moved to the other, or was it more your breast surgeon was done and then your plastic surgeon came in?
Yeah, so it was just like that. The breast surgeon
Yeah,
came in, did her thing, left, then the plastic surgeon came in.
because you went in at 7, you
So
said,
around
and
7,
got done
yeah.
at 1? Yeah, because that makes
Mhm.
sense. Okay. Yeah, mine was shorter, that's why I was wondering.
Wait, why was it shorter?
Oh, you also did 1 breath
Oh, yeah, I did 1
because
breast, right,
my
yeah. But why was why was
yeah,
yours shorter?
they were working at the same time, like, my breast surgeon started on 1 breast, moved to the next one, and the plastic surgeon was working on
Mhm.
the other breast at the same time. So, I think it made mine, just,
Yeah.
like, a go by a little
Ah, I
faster. That's
see.
why I was asking.
When I woke up around 3, I was really, like, in and out. because of the anesthesia. So I went to sleep again, and then I woke up around 5. And by that time, I was like, I want to leave. I asked the nurse to let me go.
Oh,
I
really?
call my boyfriend. Yeah, I really didn't want to be in that room
They
anymore.
made you be in recovery all by yourself?
Yes.
Oh, Matt was allowed to be like, come in, like, once I was out of and, like, was waking up, they let him come in.
I think when I was sleeping, my boyfriend Brian came
Mhm.
in, but then he left just to be with my brother and my sister-in-law.
Yeah.
But yeah, he left, and then I basically told them, like, call his ass up to, like, pick me up.
Yeah, I'm
So
outta here.
oh my gosh. So this part, I just wanna say, even though he's probably, like, embarrassed by, but I told the nurses to call him up, and he didn't fucking answer. Are you kidding me? So I was so impatient, so
And
annoyed.
were you in pain?
I wasn't in pain, I was just really out of it, but
Mhm.
I was, like, mentally there where I just knew I need to get out of this hospital.
Got it.
They finally got a hold of him, and I was able to get dressed, but I didn't leave the hospital. I think it was, like, 9 to 10 p.m.
Oh, you didn't have to spend the night?
No, I did
Oh.
not want to spend the night at the hospital.
I didn't think I wanted to, and then I didn't wanna leave.
Yeah. Well
So, I mean, maybe also because of COVID too. It was, like, mandatory that I stayed. Like, I didn't have the option to go home.
Oh, it was optional for me.
Oh, I mean,
Yeah.
honestly, if it was optional for me too, I woulda went home. Like, you know what I'm saying? Like, had they said, "Do you wanna stay? Do you wanna not?" Like, before I had surgery, I would've been like, "I'm not staying. Like, send me home after this," you know?
That's how I felt.
Yeah.
I wanted to get the fuck out of there. Yeah, so I didn't leave her until, like, I think 9 or 10 p.m. One of the things that they did was the doctor who assisted Dr. Baker, the breast surgeon, just came by to check my left breast just to see that everything kind of looks good and whatnot. And then the other doctor who assisted Dr. Slack basically came in just to check and that everything is fine and just wanted to inform me their surgery went well. So I thought that was also nice too that like both parties came through just to make sure that everything was fine. Another nurse came by to go over my discharge and just how to properly drain the liquid. So I had two drains, one for my mastectomy and then the other for the lymph node.
I wasn't sure if you only had 1 because, like, I had 2. I mean, I didn't have my lymph nodes removed the first surgery, so maybe that's why.
Yeah, I had two. I finally was able to get home finally. But the next day when I woke up, I was just like feeling my arm and I felt that like I lost sensation in the upper back of my left arm and then my armpit area. So I found that to be weird. I called them up from the phone number that was on there, just asking questions. And they basically told me if you don't feel that area, that's because of the surgery and that could happen. And so I wish, you know, prior to my surgery, the doctors just would have warned me about that.
Yeah. Also too, like, even the support groups, like, I had to go, like, to search for, like, why does my arm hurt as bad as it does? Like, I was like,
Mhm.
everyone talks about, like, the pain, but, like, nobody's talking about, like, how uncomfortable, like, your arm after is, like,
Mhm.
not just your chest.
Yes, yes. I haven't read anything like that on the Facebook groups either.
Yeah.
So, for the next few weeks, I had to do sponge baths because of the drains and just really being careful with, not wetting the drains and also, making sure that you're cleaning the breast area too and not being like too hard on it. So I think that's why shower is not permitted during those first few weeks. And then also with the drains, I had to record how many milliliters of liquid came out from both drains, and I had to record that, morning to night. And that's just for the record for the plastic surgeon to know exactly when she's able to safely remove those drains. During the first week of my recovery, Abby, my sister-in-law, she helped me get bathed. And so one of the things, or like one of the protocols that needs to get done, is just checking that if my left breast is swelling or bleeding or anything like that. So she would actually check my breast. I actually haven't looked at how my left breast was looking like. So every time she would open it up, I would close my eyes because I was just afraid that I would be disappointed in how it looks. But every time she would open up, my bra, and just to look at if everything is fine, she keeps telling me, "You need to look. It actually looks fine. Like, it looks like you have a breast." So after a few days, I finally took the courage to actually, open my eyes when she like checked my breast. And I was pretty surprised, it still has that shape of a breast.
How much did your plastic surgeon fill you during the surgery? Do you know?
I don't remember. The left breast was definitely smaller than my right breast.
Right. Because I wasn't filled at all. So that's why
Mhm.
I felt like it wasn't until I started getting fills that it like felt more comfortable too, more breast shape. Like I was like pretty flat before
Oh,
I
I
started doing the
see.
fills.
Okay. Whoever is your plastic surgeon, I guess whatever they wanna do during the procedure. I don't know what the protocol is.
I don't know what the protocol is either,
Yeah.
but I think I've read that some women do get like, the saline fills. I guess it could just also be too. I mean, the incisions are, you know, horizontal too, so it's really kind of how much your skin can stretch but still close you up, I guess.
Yes, so I had 2 incisions. One is vertical, so that's when they remove the nipple.
Mhm.
And then I had the second one that's on top
Mhm.
of my breast. So that was the skin lesion, that they had to remove because it was cancerous. So I had 2 different scars on the breast, and obviously I had a scar underneath my left armpit area because of the removal of the lymph node. Another thing that I noticed that I guess I didn't realize that would happen is when I started bathing myself. I noticed that I lost some sensation on my left breast, and I didn't know that. I don't know if your doctor mentioned that to you.
Oh,
Yeah,
yeah.
okay.
Yeah.
Maybe she
Yeah,
did.
they told me that I wouldn't have any sensation.
Okay, maybe she did, but I don't know, I guess I just forgot.
There's also so much information that they're giving you that that could have just kind of slipped under the
Probably, probably.
yeah. So that was like a surprise for you. You
Yeah,
felt like,
that was. I was like,
"Ugh."
"Okay, this is the new way of life now. Great." A week after my surgery, I had post-op visit with my breast surgeon, Dr. Baker, and that visit to go over my pathology reports after surgery. So just, the final results and how many lymph nodes were taken, and also if I had clear margin. First thing first, she talked about the lymph nodes, and she told me she removed 24. Now, I thought that was a lot. I was terrified that she removed that many, but she told me that 12 were positive and the other 12 were negative. So I can't believe that it was just so even.
It's like crazy too because there's not like a set number of lymph nodes. Like everyone has a different like they took between the first and the second it was 29, I
Oh,
think.
wow.
Between my first surgery and second, I think it was 28 or 29.
Yeah,
It's kind of like it's like a surprise. They
exactly.
go in to see how many they take
Yeah,
out.
what they do is just, like, during the surgery, if they feel like anything could be cancerous, so basically the lymph nodes are, like, pretty small, I think, I guess smaller than a pea. But if it's bigger than a pea, that's basically essentially means that it's, like, cancerous. So that's why you don't really know how many lymph nodes they'll be taking out because that's the time where they actually get to feel which ones are cancerous and which ones are not. Because of those even number of lymph nodes that were positive and negative, she just felt that confidence in that she took all of the cancerous lymph nodes out. So that was a positive. At that time, I was kind of annoyed that she took that many, but obviously now, reflecting back, it's a good thing that that happens because, if the numbers weren't even, then you have to question, did she get everything out? Did she remove all the lymph nodes that were positive?
Yeah, I also might when I talked to my radiology oncologist, recently, she told me anything above 9
Yeah.
is concerning, which I didn't know that, going into it. I had 8, but they still chose to go in and take the rest of mine.
Oh my god.
Well, I had sorry, no, sorry. I had 5
Mhm,
out of
mhm.
8. No. Yeah, 5 out of 8 when they went in the first time came up positive, and then when they went in again, it was 3 out of the 20 they took. I didn't know that anything above 9 concerning. Did they tell you that?
Told me was that 24 wasn't the highest number that she's taken. There was one patient that she had that she took over 40 lymph nodes. I
Jeez.
feel very sorry for that patient that had to deal with that.
God, I can't even imagine what her arm must feel like. I'm,
Exactly.
like, cringing
Exactly.
thinking about it.
So
Ugh.
now going to the margins. If you don't know what I'm talking about, basically the term margins is just defined, and I got this off of the breastcancer.org website. The edge or border of the tissue removed during your surgery. So the margin is described as negative, or maybe your doctor would say it's clean, when the pathologist finds no cancer cells at the edge of the tissue. So that tissue that they remove from your breast. Some doctors want 2 millimeters or more of a normal tissue between the edge of the cancer and the outer edge of the removed tissue. If it's positive, that means that the cancer cells come right out of the edge of the removed tissue. So that means that more surgery is usually needed to remove any remaining cancer cells. Going back to my margins, basically my margins came back positive, and it came back positive between the area of the vertical incision and then my horizontal incision, so the skin lesion that they had to remove. So there's a bit of skin left in between those 2 incisions. What Dr. Baker was telling me is that first things first, she thinks that radiation would help remove some of the microscopic cancer cells that is in that area. But when I go back for my implant exchange surgery next year in 2022, she will be in that procedure to remove that extra skin layer in between my incision, binding those 2 incisions together and making it to one.
I mean, that's great because 'cause I've heard so many stories of women having to go back in,
Yep,
like, 3 to 4 weeks later to go back in, like, get the clean margins and, everyone gets so upset
yep.
and, you just feel like you just kind of healed and it's, like, essentially like another mastectomy almost, you're getting more tissue taken out, so, that could definitely be, like, rough.
Let me tell you that visit, I was really nervous. Because one, I didn't know how many lymph nodes were taken and how many were positive, negative. The discussion of chemo was still up in the air. And then secondly, the margin. I really, really didn't want to go back and have like another surgery, which is why I elected to remove my nipple because I just had a feeling that if I didn't remove my nipple, I probably would have to go back to surgery to remove it because the cancer cells is just so close to it, it just made more sense to remove it during the one surgery that I had. I would say that was probably really nerve-wracking for me. during that visit.
Your lymph nodes like showed up on your PET scan, correct?
Yeah, it showed up in my MRI.
And then, so your surgeon was going to base chemo off your onco score?
She was basically going to base it how many lymph nodes were positive. Because in the MRI, it shows well, they can't really,
Okay.
like, see exactly how many, but it showed up that, like, 3 or 4 were positive. So we weren't sure, if
Until you go in.
yeah,
Right.
exactly.
Right. My oncologist was like, chemo is very much on the table. You're under 40 and reoccurrence rates are high. And so, like, I kind of like already knew going into it that like I was going to have chemo. They didn't even get an onco score
Yeah,
for
I
me.
didn't get an encore score. After surgery, when you have that final pathology report is when you really know exactly the number and if you need chemo or not, but I guess in your case, your doctor already told you that you needed it way before you got that report.
Right.
Yeah.
But going in, even for the pathology, is super nerve-wracking.
Yes. It's a lot of unknown. Once you start knowing exactly what your plan is and there's just like no more surprises is when you feel a little bit calmer. Let me tell you.
Right, because you knew that radiation was on the table, just not sure if
Yes.
chemo was. I knew chemo was and radiation wasn't on the table at that point, so I think, like, we knew we were gonna have to have some sort of treatment, but not the full amount, like,
Yeah.
we both ended up with.
Right.
Right.
Just talking about the rest of my recovery. So I was finally able to take my drains out like 2.5 weeks later. My plastic surgeon and I were just being conservative in just making sure that the drains didn't have excessive amount of liquid. As much as I hated the drains, but if the drains were to be taken out early, there could be a possibility of an infection, which I wanted to avoid.
How did it feel getting them taken out for you?
I thought it was going to hurt. And my surgeon was basically telling me like, "Oh, if you were so nervous about how it would feel, like you should have asked me." And I wish I did. It wasn't painful. Just felt like a snake was inside you or something.
Yeah, it was the
Yeah.
weirdest
It was
sensation, I agree,
so
yeah,
weird.
and afterwards, I was like, "That wasn't bad
It
at
was
all."
not bad at all, and it was so quick too. They just, like, start
Right,
pulling, and it's, like, so weird, like, they actually
right.
pull the drain out.
It's so fast. I'm normally somebody that needs to watch, like, I have to expect pain, like, when I get a shot, I like to watch, like, I'm a weirdo. When I get blood taken, I have to watch because 'cause I'm a control
Me
freak,
too.
and,
Me too.
I
Yep.
didn't watch, but it just happened so
Yep.
fast that
I watched. I was like
You
I was
watched
like
it? Oh, no.
I was like, "I need to see."
Were you
Well, because I
mortified?
thought it was gonna be painful.
Yeah. Well, she gave me, like, a countdown, like, 1, 2, 3, and
Yep.
yeah,
Same,
the way she
same.
had me, like, positioned, I don't know, I didn't get to see it.
But I'm glad it wasn't painful at all.
You felt, like, super swollen after, because I did. Like, I felt really uncomfortable and, like, swollen on my sides after getting my drains out for a few days.
Yeah, I definitely did too. And one of the things that she did mention is that, once you get your drains out, you think that you can go off your day doing regular things. But essentially, this is a time where you really need to rest because you can still get an infection. Now that the liquid is not going through a drain, it's actually like, going through your body. And so we just have to make sure that your body is resting enough in order not to get the infection. After
Right.
I removed the drain was the time that I was able to get my saline fills on my left breast. So expanding it to your desired size before I get radiation. Another aspect of my recovery, since I couldn't lift my arm above 90 degrees, it was just super important to see a physical therapist. And I saw a physical therapist after the 6 week mark because that's when I was cleared with my plastic surgeon. Each plastic surgeon probably has a different time frame depending on whether they want to be conservative or not. My surgeon was definitely conservative. What I practiced with my PT was just making sure, I'm able to like lift my arms straight and just be like a little bit more flexible, similar to what I'm able to do my right arm And we also focused on exercises that would just get me the mobility to move my left arm again. So doing like, I guess, like wall
Oh,
climbs.
so many of those.
Yeah. It sounded like you're just like annoyed to do that exercise.
Well, it's just like it's like, like another appointment. Luckily, mine came to my house. I can't even really complain. My surgeon set me up with like somebody that was like in home, so
Oh, nice.
yeah, so I
Yeah.
can't really complain, but it's like just like another appointment, and like they tell you to just literally creepy crawly your hands up the wall. Like that's it. Like that's the
Yeah.
the exercise, and you're just kind of like,
Right.
what else? What else you got? Like speed this along, please.
I do agree with you. It is annoying that, like, oh my god, there's just another appointment I need to attend. And so I think I felt overwhelmed because, I was
Hmm.
seeing my plastic surgeon, getting my saline fills. I was seeing Dr. Baker with like my post-op and just making sure that everything is fine. And all of a sudden, I have to also meet with my PT on a weekly basis. So yeah,
Hmm.
I feel you on that. But
How much like what's your I guess like CC right now? Like not
you
CC, but like how
know,
much like saline do you
I
have in
don't
right now?
remember. I don't remember. I need to check on
How many fills did you have?
maybe 4
Do you remember that?
or
Oh
yeah,
wow,
maybe
okay.
I think 4.
Because I think one of those big ass syringes is 50.
Yes. I mean, I'm a size B.
It might be just like yeah, I mean, if you did four and then I mean 200.
Well, the left breast is actually a little bit bigger than the right, and that's because she was just telling me that during
Hmm.
radiation, it can shrink. So I just wanted to make sure that, you know,
Yeah,
the left breast was just a little bit bigger so that when it shrinks, it'll hopefully be the same size-ish.
right. And they can like put in a little bit of a smaller implant like if it doesn't.
Right, right, yeah. Overall, my recovery process wasn't as bad as I thought it would be. I thought, like, my whole left breast would feel, like, super painful, and I wouldn't be able to get up or do things or eat, like, I just thought the worst. It was just really my left arm was really bothering me, but other than that, it was just resting and making sure that I'm not lifting anything heavy because that could also damage, your
Oh yeah,
scars.
opening up your incisions,
Yeah.
right.
There were 2 things I really focused on during the time that I recovered. So, number 1 was my nutrition. I really wanted to create, like, a balanced diet just so I could accelerate my healing, fight off infection, and just to increase my strength and my energy. A balanced diet just consisted of just, your protein, your fats, your carbs. I drank a lot of water throughout the day, so that was super important to me. I actually bought a big jug. I think it was, like, maybe a gallon of water, and I would drink that per day. The second thing that I did was just making sure that I rest. So, resting throughout the day, be careful not to overdo things, like I mentioned, like lifting anything. Those were the 2 main things that I focused on, and that's essentially my story of my recovery and my surgery.
By how many weeks did you start to feel like, okay, because I mean, you're never back to normal. Like, when were you able to sleep on that side? I feel like that's how I base off of when I started to feel better.
I think it was close to 7 to 8 weeks is when I
Oh,
was
wow.
able to sleep on that side. Whenever I tried to sleep on my left side, the expander is just like a block, like, it's just, like, so
Oh, God, I
hard,
know.
and so it's not as soft as, like, your breast tissue, so I think I slept more on
Mhm.
my right side, 'cause I felt more comfortable than on my left side.
At least you didn't have to back sleep, really.
That was the worst. Didn't really get good night rest
Yeah.
because I was sleeping on
Well,
my
no, because
back.
also, too, you're having to keep your arm in a certain position, too,
Yep.
to where it was comfortable. You must not have. Yeah, no.
No.
So you probably did actually have to sleep on your back a little bit.
Definitely for, the first few weeks, they tell you not to sleep on your side, but I think closer to 7 to 8 weeks is when I tried to sleep on my right side. I don't think I slept on my back as much. I like refused.
It's terrible. I think that that's why at 3 weeks, like I mean, the pregnancy pillow was helpful. I don't miss those days, I'll tell you that.
Oh no, I definitely don't miss those days. But I would definitely say that comparing surgery to chemo,
I agree, I agree. It was easier. It was so much easier.
yes,
Surgery was so much easier.
yes, yeah, way easier.
I think going into, like, radiation, which I'll start in a few weeks, like, I'm in such a great headspace as far as being like, "It can't be worse than chemo." Like, honestly, like, that's how kind of, at least at this point, like, that was
Uh-huh.
the worst. I mean, that's been the worst part. I think the waiting too.
Yep.
Chemo and, like, the waiting, like, waiting to find out results and waiting to find out, like, that part I think was probably the second worst thing, and then maybe surgery for me.
I think the fertility, like the IVF, I disliked
And that's gonna be our next
too.
episode.
Yeah. I think let's see, between the waiting, okay, waiting is number one. Then chemo, then IVF,
Really?
then surgery.
Mm,
I didn't like poking myself. Like, you have to poke yourself and inject this, like, stupid ass shit inside you, like, at all times.
yeah,
Ugh, I disliked it,
yeah.
but I knew I had to do it. I hope you guys enjoy this episode between Shauna's story and then my story, and really hope that you gain something out of this, or maybe you just love hearing other people's stories, whatever that case might be. But our next episode, like what Shauna mentioned, is going to be fertility and our process with that. So stay tuned for the next episode.
See you guys next week.
Thank you all for listening to our podcast. Sharing our stories with you has been incredibly healing for both of us, and we hope it helps other women in their journeys through breast cancer.
Ladies, if you enjoy this episode, please share it with your friends. Help us reach more women by subscribing and rating us on Apple Podcast and Spotify. You can also follow us on Instagram at TYFTS Podcast, and our email is tyftspodcast@gmail.com. We will link any resources from the episode in our show notes.